Welcome to 34 Heart Care Center. We at 34 Heart Care Center are specialized in treating heart and blocked coronary arteries with non-invasive treatments. The two treatments we serve are EECP, such as external enhanced counterpulsation, and BCA, such as biochemical angioplasty, also known as chelation therapy. EECP treatment not only helps you in reducing coronary artery blockage and heart disease, it also helps in improving hypertension, brain artery blockage, and heart failure. It also helps in improving liver and kidney functions. EECP is a very effective and proven method of treating heart patients. Let's hear from some people who've gone through this state-of-the-art treatment for their cardiovascular diseases.
It is a procedure that is used to open a clogged artery. As many as 1 million Americans have stent procedure done each year. Dr. Cam Patterson is the chief of cardiology at UNC Chapel Hill. Dr. Patterson, thanks for joining me. So
it's my pleasure, Cameron.
What do you think? Here you have this, the former president leaving out today, walking. He went in talking on a cell phone and left out talking and ready to work. Is this pretty much how you would expect a patient to be able to be up and at 'em right after this procedure?
You bet it is. You know, this is actually a pretty simple and straightforward procedure. It's basically a tune-up for the president to keep his heart healthy, and he's going to be, back in Haiti in a week from now, I suspect.
Well, let me ask you, his doctors were saying that he complained of discomfort. They were careful not to say, strong chest pains of discomfort. There are, as I mentioned, a lot of people who have this procedure, and honestly, a lot of people may find themselves facing something like this in the future. What's your advice for others who have similar cases like the president?
Well, I think the important thing to keep in mind is that the president recognized the symptoms and caught the problem early before he had a severe heart attack. And that's really, I think, the important message to get out to people who are listening to this is we need to pay attention to subtle symptoms that may reflect serious problems that could lead to a heart attack if we don't intervene with a procedure like an angioplasty or heart surgery.
And for the 1 million other Americans, including now the former president, you have this surgery. What do you keep an eye on, let's say, in the next month? As you mentioned, he wants to go back to Haiti. For most people, it's just getting back to work.
Yeah, so you have to get back to work. You have to go about your normal business. You have to pay attention to your cholesterol. He's going to be on some medicines that will keep clots from forming on the stents for a period of time. That's important. Following a good diet, keeping track of your blood pressure. Those are really the key things to focus on. It's really, the day-to-day care of his major heart issues.
Well, he is not alone. As I said, 1 million other Americans have the same procedure every year. Thank you very much, Dr. Patterson. We greatly appreciate your time.
Nowhere is the value of technology greater than in the medical arena, where every advance has the potential to better or save human lives. Let's peer into the future with some cutting-edge developments in medical technology.
53-year-old John Villano remembers a day not too long ago when he could go bowling or play softball on the weekends. Then it happened. In 1993, at the age of 36, John started experiencing chest pain at the bowling alley and collapsed. He was having a heart attack. Stents, angioplasty, medication, even open heart surgery. John had been through it all. Then John's cardiologist told him about EECP.
Well, I never heard of EECP before, but after 4 heart attacks, triple bypass surgery, and numerous stents, I figured I might as well give it a try. I really didn't want to be cracked open again.
Within weeks of receiving the treatment, John's angina was gone. Clinical trials indicate John's case is not atypical, at least not in terms of the results.
My angina was terrible. I could hardly breathe. Forget about exercising. I couldn't even walk up my driveway.
Angina is a symptom of coronary artery disease, which is caused by a lack of blood flow to a segment of the muscle of the heart. This is manifest by either chest pain or chest discomfort, shortness of breath, or fatigue upon stress or exertion. EECP increases the blood flow to the heart.
In 1995, the FDA granted New York medical device manufacturer Vaso Medical clearance to market EECP in the U.S. 4 years later, Medicare extended coverage to include the therapy. Today, EECP therapy is offered at hundreds of physicians' offices, clinics, and leading medical centers, including the Mayo Clinic, Cleveland Clinic, Duke University, and many more.
EECP consists of 3 sets of cuffs wrapped around the lower limbs and the buttocks of the patient. It is triggered by ECG, which is the heartbeat. During the diastole, which is the relaxation phase of the heart, the sequential inflation of the cuffs results in an increase in blood flow to the heart and the coronary arteries. During systole, which is the contraction phase of the heart, the simultaneous deflation of the cuffs results in systolic unloading, thereby significantly reduce the workload of the heart. The clinical safety and efficacy of EECP therapy has been well documented in hundreds of peer-reviewed publications. Findings consistently show a success rate of 75 to 80%.
The hour-long treatments are conducted daily for a period of 7 weeks on an outpatient basis. The full regimen consists of 35 treatments over the course of 7 weeks.
EECP is safe, non-invasive, is effective in improving the quality of life of patients with congestive heart failure and angina, has been proven to last up to 5 years after therapy, and is covered by Medicare and most third-party payers.
EECP should no longer considered as a last treatment option. We researchers believe that in certain stable coronary artery disease patients, it should be used first along with medication prior to any other interventional procedures.
How are you doing?
EECP is also less expensive than other treatment options. The clinical studies show that EECP reduces the emergency room visits and hospitalizations, which in turn reduces the healthcare cost.
I had EECP back in 2004, and I'm still enjoying its benefits today.
I am grateful for the treatment. I wish I'd heard of it earlier. EECP was able to give me my life back.
I took 35 therapies of the EECP, which was incredible. You know, I had some second thoughts about it at the beginning. What am I doing strapped to these things? And by the first week, I started seeing results immediately. By the end of the first week, my chest pains were gone, and this was incredible. Just that alone, that would have been incredible. But then I went through the whole 35. At my last 35, even today, every day I improve. I get more energy. I have a lot more energy about that.
मैं 1995 में जब मुझे लगा कि मैं चलते हुए बहुत थक जाता हूँ, सांस चढ़ जाता है, तो मैं बहुत परेशान रहा. मैंने लोकल डॉक्टर अम्बाला सिटी से डॉक्टर आदित्य रंजन से इलाज करवाया, पर मुझे कोई लंबा चौड़ा फ़र्क ना मिल पड़ा. 1997 में मुझे अटैक हुआ, तो मुझे परिवार वाले अपोलो इंद्रप्रस्थ दिल्ली ले गए. वहाँ पर मेरी बाईपास सर्जरी हुई 1997 में डॉक्टर मनी के द्वारा. उससे बाद काफ़ी देर मैं ठीक रहा. 8-9 साल तो मुझे ऐसे लगा कि मैं बिल्कुल ठीक हूँ. 10वें साल में मुझे फिर अटैक हो गया. अटैक होने के बाद मुझे परिवार वाले फिर बाद में नोएडा कैलाश हॉस्पिटल में डॉक्टर गंभीर जी के पास ले गए, जहाँ मुझे 3 स्टंट डले. 3 स्टंट डलने के बाद 2009 में मुझे फिर तकलीफ़ हुई. तकलीफ़ होने से फिर मैं दिल्ली गया. दिल्ली में मुझे वहाँ बलूनिंग से डॉक्टर यादव ने एम्स में कुछ राहत दी, पर घर आकर मुझे राहत ना मिली. फिर मैंने पंजाब केसरी अखबार में पढ़ा बिना चीर फाड़ से हार्ट का इलाज कर रहे हैं, तो मैं इनके यहाँ आया. तो मैं 40 दिन लगातार यहाँ पर आता रहा और 1-1.25 घंटा नित्य प्रति मेरी जो इलाज की पद्धति थी वो चलती रही. और बाद में मुझे काफ़ी आराम रहा. 40 दिन के बाद अब मैं पिछले 5-6 महीने से अपने आप को काफ़ी स्वस्थ महसूस करता हूँ और चलने फिरने में जो मुझे बहुत ज़्यादा दिक्कत थी वो अब उतनी दिक्कत नहीं है, बहुत हल्केपन में है। मेरा कलर जो ब्लैकिश में आ चुका था वो भी वाइट में और रेडिश में है। तो मैं समझता हूँ कि ये इलाज जो है बहुत अच्छा रहा मेरे जीवन में और मुझे इसने एक नई ज़िंदगी दी। धन्यवाद।
Before you started therapy and today, what changes have you noticed as a result of the treatment?
Oh, Lord. I'm alive.
EECP, which stands for Enhanced External Counterpulsation, is a non-surgical, non-invasive way of treating coronary artery disease and congestive heart failure.
EECP treats the chest pain, shortness of breath, and fatigue that come from lack of oxygen to the heart muscle, and that is what patients who have coronary artery disease and congestive heart failure suffer from, and that is what gives them their debilitating symptoms.
I had my first massive heart attack in May 29th of 2010, but I didn't have any problems with my health up to that point.
I began to notice that my energy level was decreasing. I was tiring far more quickly when walking my dogs. Going up and down steps at my home was becoming a frightful task. I just felt like I was disintegrating as a person.
The other methods that I've tried before EECP were a quintuple bypass, and I've also had 7 stents.
We kept treating it with exercise, medication, and it got progressively worse. I didn't hang as tightly as I should have to the dieting portion.
My main artery was 96% blocked. They said they didn't know if I'd make it till the next day. They did a quadruple bypass on me.
I got several stents, and the stents didn't work, so I ended up with a triple bypass. And after I had the triple bypass, I had to go back and have some more stents done. And after I had the stents done, and later on, I started having problems again with my heart, and they told me that they couldn't do anything else.
December, they told me that I wasn't going to live to see January because I had less than 10% of my heart left and it was dying quick.
EECP works its magic through a series of pneumatic cuffs that are similar to blood pressure cuffs. They wrap around the calves, the thighs, and the waist. They inflate and deflate, timed very specifically off the patient's heartbeat. EECP is effective because it's not simply covering up a problem. It's helping to provide a long-term solution for a problem.
It will treat their chest pain, their shortness of breath, and their fatigue by delivering more oxygen to the heart muscle and to the muscles all throughout the body. And in that way, those muscles can function more effectively, and the patient is able to do more.
Went in with completely open-minded, not pessimistic, not optimistic. And I can tell you that it did a world of wonder for me.
I have more energy, and I can get around more, and I can walk more, and I can do more things without getting tired.
I would even say that her thinking is a lot clearer now. The choices that she makes, she's exercising more on her own. So I would also say that her quality of life is a lot better than it was before.
The changes that I've noticed have been increased stamina, less shortness of breath, just overall feeling 100% better. Amazing.
I sold my car and my furniture and bought a 37-foot Class A motorhome. I'm ready to hit the road, and I wouldn't have been able to do that had it not been for this treatment.
I was thinking of calling back my old cardiologist to say, hey, you know, you gotta look at things, you missed something.
I would simply say, in coining a phrase that's frequently used, that it's the best kept secret. It truly is. It's a great therapy, and it's something that you don't want to miss.
With the support of my wife and Legacy Heart Care, you know, I feel like I beat all the odds. You know, they are a miracle to me.
हेलो, मेरा नाम डॉक्टर रश्मि शर्मा है। मैं बड़ी परेशानी में थी और ये जरा सी भी चलना भी मुश्किल था। धड़कन का बढ़ना और चेस्ट में पेन होना, पूरे बाजू में पेन आता था। जिससे कि मैं चलने से बहुत परेशान हो रही थी। और मुझे डॉक्टर को चेक करवाया गया तो उन्होंने कहा कि एंजियोग्राफी करी जाएगी पहले आपकी। मेदांता में मैं 2 दिन एडमिट रही और वहाँ पे मेरी एंजियोग्राफी हुई। उन्होंने कहा कि इमीडिएट एंजियोप्लास्टिक होगी आपकी, तभी ज़्यादा बेहतर हो सकते हो। मैं इस हाथ में नहीं थी कि मैं एंजियोप्लास्टिक का ट्रीटमेंट लूँ और मैं के पास आई। उन्होंने मेरे को कहा कि आपको मैं ECP का दूँगा। उससे मेरे बड़े बेहतर रिजल्ट रहे, जो कि मैंने 45 डेज़ का ट्रीटमेंट लिया गया और अब मैं इतनी बेहतर हूँ कि 2-2.5 किलोमीटर में सैर कर लेती हूँ और सीढ़ियाँ चढ़ना अपना मैं पूरा काम करती हूँ, क्योंकि मैं 10 कदम भी चल नहीं पाती थी। और उसके बाद मैंने टेस्ट, इन्होंने डॉक्टर ने एडवाइस किया कि टेस्ट करो ताकि आपका ब्लड सर्कुलेशन या हार्ट की क्या प्रोग्रेस है। तो मेरी 100% ठीक आई और अब मैं पहले से बहुत ठीक हूँ।
Visit us now at 34 Heart Care Center for more details, or visit our website at www.34care.com to get treated today for cardiovascular disease with no pain, no surgery, and no hospitalization. You will get safe and secure treatment at 34 Heart Care Center and Healthy Heart.